Making mistakes with medication can cause serious health risks, but there are some common mistakes that people are making, including taking medications that you actually don't need or forgetting to take your medication.
Right. Demond Fernandez sat down with an internal medicine physician about what the mistakes he's seeing that people are making.
Okay, so many people take prescription drugs, but some doctors say it's our habits around taking drugs day to day that has some of them pretty concerned. Managing prescription medicines can be simple or overwhelming at times.
I forget sometimes, you know, we're human.
Depending on who you ask. Are patients making some common mistakes?
Absolutely. There are a lot of common mistakes patients will make when they're taking their medications.
Dr. Sean Drake is a general intern medicine senior with Henry Ford Health. He manages patient medications, and he's weighing in on some of the common issues he's hearing from people about their habits around prescriptions.
One of the most common things I see and I hear from my patients is just forgetting, just not taking it.
Forgetting is a big one, especially for those taking medicine several times a day.
A classic example is something that's given 3 times a day. It's very common. They'll remember their first dose in the morning. They'll remember their dose when they're going to bed. It's that middle dose is oftentimes a challenge.
Dr. Drake says if you're failing to take prescribed drugs correctly, you could risk side effects and other complications.
My medicine come up to $104.
And we know there are realities for many people around affordability.
Not being able to afford your medicine is a very real problem. Sometimes it can result in them not being able to take the medicine at all, or they'll have to make decisions of I can take this medicine this month and this medicine that month, but aren't necessarily taking all of their medicines like they need to.
And that can be kind of tricky when it comes to care.
Absolutely, it becomes very challenging.
If the cost of your meds is a concern, Dr. Drake suggests speaking with your healthcare provider or even your pharmacist. They may be able to recommend programs and more.
They can look at your options. Sometimes it's a matter of switching to a different medication, a generic form.
And are you someone who keeps a list of all the medicines you're taking? If not, Dr. Drake says that's something to seriously consider.
I find it very important, especially as the number of medications you're on goes up. It can get complicated, as I said, to remember how to take them all.
Maintaining a list of your prescriptions also allows your family to stay on top of what you're taking, even in cases of emergency.
And one other common mistake Dr. Drake says he hears about is people taking prescription medicine that belongs to a family member or a friend. He says that's a big no-no.
That's because the dosage amounts could be different, among other issues. You can find a list of Dr. Drake's recommendations and other prescriptions-based resources at clickondetroit.com.